विधेयक पर चर्चा करना मैं समझती हूँ, इसके बारे में पॉजिटिव चर्चा कर।
Thank you very much, ma'am. Ma'am, the Central Excise Amendment Bill 2025 revives excise duty on tobacco products after the GST compensation cess expires, undermining GST's foundational promise of one nation, one tax. This will leave manufacturers dealing with 2 tax audits, 2 valuations regimes, double the filings, and the risk of old excise disputes, ma'am. The bill and its explanation do not clarify how the dual systems will coordinate or share data, nor do they address the added compliance burden. Ma'am, Parliament must therefore demand a clear harmonization framework through unified audits, shared portals, or transitional rules before approving this shift. Absent such safeguards, the bill risks fragmenting India's indirect tax structure and complicating compliance for the tobacco industry. Ma'am, as far as safeguards are concerned, so many members have spoken about health risks. First, e-commerce and quick commerce platforms are delivering cigarettes and other tobacco products without any real age verification, making it frighteningly easy for children and minors to access them, and weakening the very protections built into the COTPA. Second, the 100-yard prohibition meant to keep tobacco away from the school, hospitals, etc., is simply not being enforced, whether offline or online. Digital delivery allows these products to reach children without any of the safeguards that exist in the physical world, ma'am. I urge the government to state whether it has taken cognizance of these violations and what action through notices, penalties, or prosecution is being taken to ensure that online platforms do not become the easiest gateways for our children to obtain tobacco. Ma'am, health risks are many, and this has been noted also by the Supreme Court, who has called this a generational threat. It's a multi-dimensional public health emergency. And my question to the government is that since divinity descended on this nation 11 years back, does divinity allow us to provide poison to the population for money? Are we not going to think about getting away with this? Ma'am, India spends far more on treating tobacco-related disease than it earns from taxing it. The economic cost of tobacco use stood at 1.77 lakh crores in 2017-18, while excise tax collections that year met barely 12% of this burden on our families and health systems. This is not just a fiscal mismatch. It reflects the human cost we can no longer afford to give, ma'am. Ma'am, if we are ready to compromise with the health of this system, I don't think we are anywhere near divinity. I would like to, ma'am, speak about lip service to divinity. If we are just calling ourselves very divine and very spiritual and talking about it, it will get us nowhere, ma'am. Shakespeare has said, nothing gets nothing out of it. So, ma'am, we are just saying nothing and earning nothing because we are in the same place, compromising with the health of our citizens. I urge the government to send this bill to the Standing Committee on Finance for thorough examination and recommendations on integration, ma'am, and also coming out with a comprehensive policy which also gives us an enlightenment of what are the health risks, how much are we spending on tobacco use inflicted diseases, and how much we are earning out of it. If we make a comparison, I think it will show us that if we do away with this revenue, the health of the nation will progress, but we will also go towards financial positivity in a few years, ma'am. Thank you.